3. With limited space in which to grow, the roots can change direction, increasing the difficulty of removal. The thin blue lines point to the ends of the root of the wisdom tooth. They seem to curl in the way they did because as the root grew, it had to grow to a certain length. It ran into resistance, probably of the jaw nerve canal, so they bent off to the side to finish their growth. The nerve canal is pointed out by the large blue arrow, kind of outlining and pointing in the direction of the nerve canal, which is a broad dark line that goes through the jaw. Imagine how difficult it would be to remove this tooth without breaking the root. What happens if a root does break? Well, if the broken root fragment can't be removed without risking injury to the jaw nerve, for example, it could cause an infection. And if it does get infected, it has to be removed to eliminate the source of the infection. 4. Again, because of limited space, the roots of the lower wisdom tooth can grow closer to the lower jaw nerve, risking injury to the nerve during the wisdom tooth removal. The blue arrows point to the path of the lower jaw nerve. You see one root of the wisdom tooth has grown straight. The other wisdom tooth root has actually appeared to bounce off the nerve canal and grown off to the side almost 90 degrees to its partner. This would be a difficult tooth to remove without there being considerable risk to the jaw nerve and the position that they are in to each other. So as you can see, there are many problems that come with waiting. Consider this also. How do you know? Some of these cases, they're unusually difficult. Fortunately, not every older adult walks in with such problems, but how do you know how a wisdom tooth is going to end up growing? The problem and the gamble is you don't. And if you lose, sometimes you can lose big, like in these cases. What if the wisdom tooth problems occur when your daughter's pregnant? Treatment becomes much more challenging and difficult due to the limitations on the medications that the surgeon can use, both for treating the infection as well as perhaps sedating her if that's going to be necessary to comfortably remove a difficult wisdom tooth. Medical problems may have developed over time that must be controlled before any surgery can be done. An example of this would be hypertension. When blood pressure becomes so high that a patient cannot be treated without the risk of stroke, for example, it doesn't matter how much that tooth is hurting, it's not going to be treated until that blood pressure can be brought down by his physician to make treatment much more safe for that patient. Another example would be someone who's had a recent heart attack, and yet they've got a wisdom tooth now that's infected. What do? Well, you can't take that wisdom tooth out just because it's hurting in a patient who has had a recent heart attack until they get clearance from their cardiologist that the heart has actually healed enough to allow the surgery to be done. What do you do if you have an elderly patient where treatment becomes a serious risk to a medically compromised patient whose health can't be improved enough to have the surgery performed safely? With all these potential problems at stake, why do so many gamble with the wisdom teeth? For the relatively few whose wisdom teeth do come completely into the mouth, do they really use them for chewing? It's pretty far back to chew food. Can they clean them well enough to prevent cavities or gum disease? Well, I think you know by now that I believe the answer in most cases is no. Just remember the cavities we saw in the wisdom teeth earlier. Is there a time when wisdom teeth should be allowed to come in? Yes. Let's say, for example, that child grew up missing a back tooth, where there would be room for the wisdom tooth to come in its place. Or perhaps they lost a permanent molar tooth prematurely from a rapid cavity that caused it to be removed. Or let's say that the premolars, the bicuspids, the teeth that are behind the eye teeth, behind the canines, perhaps one in each corner has been recommended to be taken out by the orthodontist in order to be able to straighten crowded teeth. These situations are just not that common. For most people, ignoring wisdom teeth until problems arise can be like walking around with little ticking time bombs in their mouth. Yet, almost all of these problems can be avoided by doing one simple thing. Remove the wisdom teeth before the roots finish growing. The solution, it's just that simple. Why? Immature teeth are smaller. The growing ends of the roots are soft. The young bone is softer than later in life, and if you remove the teeth before the gum gets infected, healing improves. Look at the areas that the thin blue arrows are pointing to on the growing wisdom teeth. They're pointing to some dark areas where the root would be forming. The reason those areas are dark is because they haven't calcified. Calcium is the substance that turns bone and teeth white. Therefore, it means that those areas have hardened. Well, the areas where the roots are growing are dark, so in this case you can expect that those areas are soft. Besides avoiding most, if not all, of the 9 problems you just saw, the surgery is easier. The teeth are smaller, the bone is softer, it's less risky, again because a soft root laying against a lower jaw nerve has a lesser chance of injuring it than if the nerve is laying against a hard root. And younger patients generally heal faster and better. Now, while no surgery is risk-free, the surgery on a teen is generally far less risky than it will become in later years. So, since there are many more risks that come with waiting than not, this table shows all the problems we just spoke about when you wait until the wisdom teeth have caused problems. Whereas on the left, if you get them out before they cause problems, there are no problems. The common thread being that there is a chance of post-op infection in either case. Can't avoid that surgery. So, if there are many more risks that come with waiting than not, unless teeth are missing that shouldn't be, is there really any logical reason not to remove wisdom teeth in the teens? When's just right? Is there a right time or right age? Actually, I judge ideal timing on the stage of development of the teeth, which differs from person to person. Now, while one 15-year-old may have fully grown wisdom teeth, another may have just started growing theirs. For most, I think it's wise to start looking at the age of 15 or maybe even mature 14-year-olds. Now, here's a case of a young male. On the left, his wisdom tooth at age 14 has not started developing a root. Yet at age 18, the root probably 2/3 formed. In fact, one of the roots is even starting to curl. And the other thing you might notice is that the roots are now a bit closer to the jaw nerve. So I think for this patient, his ideal time to have gotten the wisdom teeth out would have actually been around 16 or 17. In addition to root growth, the bone gets harder as we age. Now, there's 2 things on these x-rays that I noticed. The broad blue line points to a thick white line that is the outer dense bone. On the right, at age 18, that dense bone is actually wider than that same area at age 14, where it appears to be narrower. Therefore, the thick, dense bone is less thick. The other thing I noticed about these x-rays is if you look just to the left of that thick, dense bone we were talking about, that general area actually looks whiter than the area at age 14. That tells me that the bone in general has become more dense. So the removal of the wisdom tooth at 18 is going to be harder because the bone now is thicker and denser than it was at 14. So as bone becomes harder, the surgery to remove the wisdom tooth becomes more difficult. I tend to use an analogy that removing wisdom teeth is very similar, or teeth in general, is similar to taking a fence post out of dirt. As we age, that dirt becomes drier and harder. Therefore, the rocking of the post back and forth becomes harder and harder to do to get the post out of the dirt. A young patient's dirt is much more like dirt after having rained. It's soft, it's mushy, it's much easier to remove a tooth than in hardened, dry dirt. Hope that makes some sense. So teeth, as a rule, can be removed from bone much more easily at the age of 15 to 18 than at any time later. Remember, this golden opportunity to remove the wisdom teeth when they are immature and the bone is soft only comes once in a lifetime. To take advantage of this opportunity, bring your teen preferably around the age of 15, to an oral surgeon for an evaluation of their wisdom teeth. This is done by taking a panoramic x-ray of their jaws to determine the need to keep one or more of the wisdom teeth and to assess the development stage that the wisdom tooth roots are now at, so you can ideally time their removal. But if you miss this, the next suggestion would be to do it as soon before age 25 as possible. Doing so takes advantage of whatever bone softness might still exist, as well as doing surgery on a younger, healthier body for faster healing. Okay, class, what have we learned? Can wisdom teeth be easily removed at any age without problems? I believe that surgical difficulty and complications in general increase with age. Is it worth waiting to see if they will come in? I believe that the added difficulty and risk of waiting outweighs any benefit gained, even if they come in completely. And finally, what can happen once the wisdom teeth come partially through the gum? Well, at that point, infection now is possible, and even if you don't develop an infection of the gum, cavities certainly are bound to come. If your time is limited and you need to stop, here's our number to make an evaluation appointment for your son or daughter. 813-972-3478, or you can email contact information to info@grellnerdds.com. But wait, there's more.